The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference.
I'm Susan Brender, and this is the Susan Brender Show. Today, I have two guests on my show. One is Brett Steinberg, who's a South Florida plaintiff's personal injury lawyer and a car accident attorney located in Delray Beach, Florida. And for many years, as a young guy, he wanted to improve the health and the wellness of South Floridians. As a lawyer, he was just trying to help them as much as he could. Now, my next guest is Dr. Jeffrey Stenger. He's a chiropractic medicine doctor with a whole bunch of wellness that is treating people so well, getting them much better. And the two of them are very special people. And I want to welcome Steinberg, Brett, and I want to welcome Dr. Stenger. Welcome to the Susan Brender Show. It's really a pleasure to have you on.
It's a pleasure to be on. Thank you, Susan.
You know, let's talk a little bit about this. And this is geared to you, Dr. Stenger. You know, personal injury accidents happen all the time. And it is so important that there is somebody who can help them through it. Give me the first steps of what happens when somebody walks in your office. Tell me what happens, basically.
Susan, you talking to Dr. Stanger or to Brett?
I'm talking to you, Dr. Stenger. What happens when people walk into your office? Take me through the steps.
Okay, well, we greet them enthusiastically, treat everybody like family, and they fill out an intake package that describes the circumstances of their visit. If it's an accident injury, we'll then do a consultation with them, finding out the particulars of what happened in the accident so that we can address their complaints accurately. We do a thorough consultation, examination, which includes orthopedic and neurological testing. We do some posture analysis. We also do digital x-rays, and we set them up for their first therapy session. We also, during the consultation, ask them if it was no fault of their own, if they're interested in having legal protection so that their rights are maintained.
There you go. You know, I'm very interested in knowing, Brett, you must see quite a few people who have accidents, and there's a level to which, you know, you kind of say to yourself, these people need help, and I am going to try to win for them. How many times have you seen or taken people to the jury? And in Delray Beach, curiously enough, how do they usually vote?
So we litigate most of our cases in the West Palm Beach. That's a great question, by the way. In the West Palm Beach area, that's where the circuit court is located in downtown West Palm Beach. We find that the juries in Palm Beach County are a mixed bag. We definitely have our share of conservative voters and our conservative people out there, and we have our share of liberal voters and liberal people that sit on the jury. But the most important thing is when trying a case, which I've tried as far as personal injury. I've tried a handful of personal injury cases, and I've tried a lot of cases in front of a jury. Generally, I started out my career as a Miami-Dade public defender, so trying cases is something I've done plenty of. And I have to say that as long as the lawyer conducts a very extensive voir dire, which is the part of the jury selection, the part of the trial called jury selection, and as long as you ask the right questions and you use your senses to listen to people and understand people and make sure you get a sense of where they sit, it's at least easier to stack the cards in a way in which the jury's on your side. Does that answer your question?
It sure does, Brett. But here's the thing. You hear, I'm going to give you an example, frankly. I had a situation where I had an accident where my whole ankle was crushed. My heel was crushed. And I went to a lawyer. Now, maybe I'm going to ask you this. Maybe it was a mistake because I went to a friend who was not a personal injury lawyer. And the courts, I brought a lot of witnesses to the court, and the court, or actually the company, my insurance company, wanted to settle. Now we're going to talk a little bit about settling a injury case. He wanted to settle. And they said, I'll give you $100,000. Now, I went to the lawyer. I said to the lawyer, should I take it? And the lawyer's answer to me was, no, you're going to get a fortune. Leave it alone. And guess what I ended up with, Brett?
What did you end up with?
$25,000.
So what did you settle that case for $100,000?
I did not settle it because my lawyer gave me the wrong information. And what happened was this jury was in Bergen County, New Jersey. And, you know, that is a very difficult place to settle an accident. Now, I'm sure that you would be very honest with your patients, correct?
Very honest with my clients, yes.
Okay. So if a company says they're going to settle, do you usually settle?
So most cases generally do settle, but I mean, I have to tell you, I don't know. You told me that this matter that you had was handled under New Jersey law. I just want to make sure it's clear that I only practice in the state of Florida, so I cannot give any legal advice, even an opinion on what happened to you with respect to your case. So I don't know what the jury was like there. I don't know what the laws of court. They're probably fairly similar to here in Florida, but there's always nuances that are different from state to state. But the reality of it is I don't think you made a mistake. It is quite possible that you should have had, or probable that you should have had, a personal injury lawyer handling this and not just a friend who handled all types of cases, right? So I think part of the problem is, you know, it's like if I have a back and I've got back issues, I'm going to go see, you know, Dr. Stanger, you know, and presumably maybe he'll refer me out to an orthopedic doctor to go see to do that. But at the end of the day, I'm not going to go to my primary care physician and complain about back pain, or I'm not going to go to a knee doctor and complain about back pain. I'm going to go to that, you know, I'm going to go to that back doctor. So I think part of the problem is you didn't go to a specialist in the trade. And I haven't settled a foot or ankle crush injury for less than $500,000 in all the 11 years I've been practicing. So I'm a little bit surprised, but I don't know all the facts of your case. So that's my answer for you there.
You know, Brett, I'm very happy that you mentioned that, because our show is an educational and informational show, and you're giving people the idea. And the most important information is, if you have an accident that is an injury accident, don't go to a regular lawyer. Go to a personal injury lawyer. And
absolutely.
That is a very interesting point. Let's get back to Dr. Stenger.
And Susan,
yeah,
that's a great point to make also when choosing a treatment doctor. Choose a treatment doctor that's familiar with and knows how to treat and document accidental injury. Very important.
Yeah. Now, okay, walk us through something, Dr. Stenger. Somebody comes into your office, they've had an injury, they have a back injury, they have a knee injury, you name it. What is the first thing that you do? What do you say to them?
We say that we're going to evaluate the extent and types of injuries you have. If you need someone who's outside our office, because we're a mixed practice with medical and chiropractic. But if it's somebody that we don't have, a specialist that we don't have, we'll refer you to the appropriate specialist after we evaluate the extent of your injuries.
Yeah. Chiropractors can address different symptoms, Dr. Stenger, as well as muscle ligament tears. Could they help with fractured bones, whiplash, spinal damage, as well as muscle ligament tears?
Some of those things, yes. Broken bones, no. We are conservative treatment doctors, so we start conservatively. If somebody fails to respond to the treatment we render in a reasonable amount of time, we send them out for further intervention.
Yeah. And what about mutually addressed issues such as spinal? Well, I just call it manipulation. What is manipulation?
Manipulation is a form of a spinal adjustment where we detect and locate areas of the spine that, in this case, were injured in the accident. The muscles are in spasm, restricting motion, and we restore the motion back to the joint so there's less inflammation and the patient client starts to feel better.
You know, this question, the next question that I have for the two of you is during this terrible crisis that we're going through, and I'm talking about the pandemic, did you see more people than you usually see? Because there is so much stress around, and people, you know, have been stuck at home, and, you know, they don't even know what to do with themselves. But one of the things, and I ask you this, Brett, too, did you see people, or have you seen more people that are in accidents because of all the stress that they're going through?
Well, initially, when the pandemic first happened back in March of 2020, when it first broke out, we were dead, right? There were no cars on the street. There were no people walking out and about. And I mean, we were busy from the existing clients that we had, but actually, you know, it was a scary time to be being any kind of business, right? Because there weren't any cars out and about, and there weren't any people walking. But that was a short-lived thing. I would have to say that starting in like May or June of 2020, we picked up again. And, you know, I don't know that I've seen any more volume than I've seen previously, but, you know, South Florida, I mean, you get all types of accidents. So whether these people are stressed out from COVID or they're distracted on their phones, unfortunately, South Florida's got a reputation for some bad drivers, and more unfortunately, we live up to it.
Yeah. Dr. Stenger, okay. So do you see a diverse audience coming to you? And I call them an audience, but I'm talking about patients. Very diverse. Because when I'm in your office and I tell all the people that I visit that it's a very interesting office because I see a lot of people diverse. And I think that is an important thing. Can you tell us a particular story of one of the people that have come into your office that is really unique?
Well, we have lots of unique patients here. We're a diverse practice. We have two components primarily. One's a health and wellness component, those who are not feeling their best and want to feel better, those who want to optimize their health so they can perform better. And then we have an accident injury component, which is a mixed practice, medical and chiropractic. And our goal is to take those who were accidentally injured all the way back to health and wellness.
Yeah, and also, Mr. Steinberg, it is also a very interesting time. We've talking about, you know, this particular time where there is that much stress. Now, the question becomes, when somebody walks into your office and they said, I just had an accident and I deserve a lot of money. I deserve it. How do you respond to them?
Well, it's a great question because I always take advantage of the time I have with new clients during our initial consultation visit, which is a 1-hour consultation that's free. You know, when somebody comes in with expectations that don't meet up with reality, which is basically the situation that you're describing, I explain to them that there's in any area of the law, there is no guarantee with respect to the outcome of any given case, right? That's number one. Number two, the reality is that we've got a few things to prove. You know, if you're talking about an auto accident, sometimes it's a lot easier, assuming that, say, there's a rear end or there's no liability dispute, but we still have to prove what's called causation and damages. And causation is, you know, medical causation and actual causation. Did this accident cause these injuries, or was it due to some pre-existing condition you had? Dr. Stanger can talk to that as well. So we deal with pre-existing conditions. And what we argue is, if the person did have a pre-existing condition, assuming they were not asymptomatic entirely before the accident, we can say this was an aggravation of a pre-existing condition, but we still have to prove that. And then damages, how injured are you? So we explain to people that we are in a business relationship together. I work on a contingency basis. The more money that my client makes, that the case settles for, the more money I make, the more money my client makes. So I explain to them that I would love it if every case were worth $1 million, but that, I tell them, you don't want your case to be worth $1 million because that means you're very, very badly injured. So when I explain those factors to my clients, they usually back up and say, okay, first of all, this lawyer knows what he's talking about, which I do. And second of all, it makes sense.
Yeah. Now, what about trust? One of the things, it's a cliche. People talk about lawyers and they talk about chiropractors almost the same way. And what they say is, can we really trust them? How do you prove, Dr. Stenger, that they can trust you?
Well, that's a good question. Firstly, we're in Delray for almost 40 years continuously. And that in itself speaks a lot about our results and the trust that the community has in us. And we have lots of testimonials to confirm what I've just said.
Well, I'd like to know one of the testimonials that, has been presented to you, because people will come in and, they'll leave and they don't even think about the fact that, you need a little TLC and a little bit of encouragement, and that's how you get new patients. So is there any testimonial per se that really stood out in your mind and that you can relate to our audience?
Well, a couple of them. One, on an occasion or two, somebody comes in not knowing too much about chiropractic and physical therapy, came to us almost as a last resort. And as a result of the relief of their symptoms that we achieved for them, went on to say that they came in skeptical, but they're so glad it was one of their best choices that they've made to choose the chiropractic physical therapy route.
Now, what about just coming in, not necessarily with pain, but is it a preventive way of dealing with your body?
Well, we refer to it as functionality. Pain is a symptom that you can always mask with medication, but we help restore function to the body so that your lifestyle and activities of daily living can be improved.
Yeah. And Brett, you mentioned that you had a relationship with Dr. Stenger. Is that true?
Yes, we've worked together in the past. Absolutely.
Right. And the patients that have come to you from Dr. Stenger's office, anybody unusual, anybody who gives you a testimonial about how great he is?
Oh, I can tell you this. There isn't like just one that kind of sticks out of my mind, but I can tell you that, first of all, I've known Dr. Stenger personally for a few years now. He has an excellent reputation in Delray Beach. And anytime we've worked together, whether it's been that he's referred somebody to me or I've referred somebody to him, they've only given him and his office and his staff the most glowing reviews. So there isn't just one that stands out, but I can tell you that everything has been positive.
Yeah, Brett, there's another thing that I'm interested in. We live in Southeast Florida, and the population of this particular town or area is very old. And some of these people should not even be driving. Do you find that you see a lot of elderly people in accidents coming to you and saying, please help?
Yeah, I definitely have seen an uptick in working in South Florida in those types of cases where either my client, is an elderly person who may have been at fault for causing the accident. I unfortunately had to not take the case. Or in the alternative, what I do see more often than not, I would say a fair amount, is that the defendants on the other side of the cases, or the clients that I represent, are hit by people who are older, because it's just at some point they just shouldn't be driving. So yeah, that I think that I think that's a fair estimation.
Brett, if there is a situation where, and it's a sad thing to say that I'm going to say to you, and that is, shouldn't we take our licenses away from elderly, especially those who drive, and some of them have Alzheimer's even? Shouldn't we take away their license?
No, I don't. I mean, I don't think it's fair. I mean, elderly is like what, technically 65 and over. I mean, my parents are in their 70s and the 80s. I mean, I think that there needs to be a point where there's a mandatory vision test and a mandatory test just to make sure that at a certain age that everyone's driving with faculties. I think that's probably, I understand it may be a little bit more expensive to administer, but to just say, yeah, let's just take licenses away from elderly people, I don't think I can get behind that.
I hear you. All right. Now, Dr. Stenger, there are some injuries that should not be handled by just a medical professional. Unfortunately, there are many injuries that are ignored, covered up pain management. How, what do you feel when you hear something like that people ignore their injuries? Shouldn't they come to a chiropractor just to ask you questions, just to kind of find out how you can make them better?
Well, we like to offer second opinions, and we evaluate diagnostic examinations such as CT scans, MRI scans, X-ray scans, and help give the person who's seeking it a second opinion as to what we believe is the best treatment plan.
Yeah. Through spinal manipulation, the spinal column is reliant and promotes the body to release anti-inflammatory substances to aid pain and inflammation. Would you say that is a correct statement?
Yes. I believe so.
Yeah. And what about kids? We've talked about, and we really haven't mentioned particular ages, but what about kids, teenagers in particular? They're a little bit, they have a very brazen attitude about a lot of things that they do. And actually, this is for you, Brett. Do you find that teenagers cause more accidents than adults?
Do I find that teenagers cause more accidents than adults? I have not seen that. I imagine that there's a fair amount of teenagers out there causing accidents, but and it would probably logically follow, because I think that the younger people are definitely driving distracted. But personally, in my practice, it has been such a mixed bag. But I can tell you that when I've had cases where I could prove distracted driving, it was more likely than not in cases that involve teenagers or young adults, in their 20s.
Right. And what about this situation in Florida in particular, where you can actually talk on your phone? And I see tons of people driving with their phones right in their hands, and you see them weaving back and forth, and they're not paying attention to their driving. This is a travesty. Don't you think, Brett, it's a travesty?
I think that distracted driving is probably one of the worst things that could possibly be out there. I don't think people should be on their phones when they're driving, at least not holding a phone to your ears, because that's distracting. I think if you're going to be talking on the phone, which you should do sparingly, it should be through the car's Bluetooth audio, which is, available in most cars these days. But to be sitting there texting while you're driving, talking on the phone with the headset up to your ear, doing anything with that phone while you're driving what the law considers to be a dangerous instrumentality, I think it's pretty bad. I agree.
Yeah. Dr. Stenger, I'm wondering, because you've talked about this lawyer, this wonderful lawyer, Brett Steinberg. Do you have a question for him?
Well, no, Brett and I know each other. Brett does a great job. The way it works in accident injury is that generally the patient has to treat to feel better and reach maximum medical improvement, at which time we give Brett, in this instance, all the tools he needs to settle the case, and then he takes over from that point to conclusion.
Yeah. And the same thing holds true for you, Brett. Working with Dr. Stenger, has it been a really interesting experience for you? Because he's been in the business a long time and you've been in the business a little bit of time, but there must be something about Dr. Stenger that says to you, I'm going to send my patients, or in your case, my clients, to Dr. Stenger.
Sure. I mean, I've been in the industry for about 11 years now, so I think we can consider that a little bit more than a little bit, just to clarify on that. But with respect to working with Dr. Stenger and professionals like him, Dr. Stenger, I have to tell you that I recall working with him and recall, what you want out of a chiropractor is communication. You want, when you request that they send over medical records and billing records and a final report and whatever it is that you need, that they send it over expeditiously. And I can confirm that's what Dr. Stenger does. And he's a professional.
Yeah. I only have a minute left for the show. Do any of you, and I'd like to hear it, any of you have the last word? Give me the last word. What would you tell our audience?
I would tell audiences to take care of yourself and listen to your body, and call a chiropractor if you're not feeling well, or if you get into a car accident, or somebody that got into a car accident, call an attorney. Because I think that with respect to the chiropractor, like especially one like Dr. Stenger, they can help you feel better. And if, like he said, if conservative treatment doesn't work out, they can help direct traffic and get you to somebody who can help you out. And with respect to an attorney, if you don't have counsel on your side, insurance companies will walk all over you. And I know Dr. Stenger knows that's true too.
And Brett, if they want to get in touch with you, how do they get in touch with you?
Sure. You can reach us at our office at 561-630-0053. Once again, that's 561-630-0053, or email Brett at brettsteinberglaw.com.
And Dr. Stenger, I want to give you the last word. We've got about 30 seconds, so please give me something that you think our audience is going to really find very interesting.
Well, when it comes to accident injury, somebody like Brett, who specializes only in accident injury, is an important choice to make, not somebody who does everything. And it's important to seek care rapidly so that the condition doesn't become harder to correct and fix. Also, there's all sorts of laws built into the automobile insurance world that requires immediate action on the injured part, or they lose their rights to their insurance coverage.
Yeah, and how did they get in touch with you, Dr. Stenger?
The best number is 561-498-4300, and email is Dr. Stenger at shcc1.com.
Well, it's been great having Brett Steinberg and Dr. Jeffrey Stenger on my show, and I want to thank you very much for being on the Susan Brender Show. It's been a pleasure.
Thank you.
Thank you. I look forward to seeing you soon.
Likewise.
Thank you.
Thanks, Susan. Take care now.
Okay, bye now.